This training aims to teach you about the meaning of pharmacovigilance. When training is complete, you will know about what is an adverse reaction, the minimum information to be noted while reporting an adverse reaction, the period of time during which you have to report the adverse reaction, and the significance of pharmacovigilance in terms of public health. Pharmacovigilance is a vitally important public health service aiming to rapidly detect and intervene with potential safety threats associated with the use of medicinal products. Etymology: pharmakon, medicinal product in Greek; vigilare, to be vigilant in Latin. Pharmacovigilance aims to establish guidelines related to take the measures required to systematically monitor adverse reactions, to collect, keep records of, assess, and archive information, to establish contact among parties, and to minimize any potential damage to be caused by medicinal products in order to ensure that medicinal products are used safely. In 1937, following the deaths within a week of 105 people, out of whom 34 were children, as a result of the administration to 353 patients of sulfonamide elixir containing diethylene glycol, the first ever legal regulation came into force in the USA in 1938. 1961, numerous phocomelia cases associated with thalidomide were reported. Side effect: any unintended effects of a medicinal product. Adverse reaction: a response to a medicinal product which is noxious and unintended. This definition covers adverse reactions arising out of the following: the use of the medicinal product within the terms of the package insert, the use of the medicinal product outside the terms of the package insert, overdose, off-label use, misuse, abuse, and medication errors, occupational exposure. Adverse event, AE, adverse experience: any untoward medicinal occurrence in a patient or clinical trial subject administered a medicinal product and which does not necessarily have a causal relationship with this treatment. An adverse event can therefore be any unfavorable and unintended sign, symptom, or disease temporarily associated with the use of a medicinal product, whether or not considered related to the medicinal product. Serious adverse reaction: any adverse reaction which results in death, life-threatening condition, inpatient hospitalization or the prolongation of hospitalization, persistent or significant disability or incapacity, congenital anomaly, or birth defect. Any suspected transmission via a medicinal product of an infectious agent is also considered a serious adverse reaction. Unexpected adverse reaction: an adverse reaction, the nature, severity, or outcome of which is not consistent with the summary of product characteristics. Definitions: healthcare professionals considered as reporters for reporting purposes: doctors, nurses, midwives, dentists, pharmacists. Consumer is defined as a person who is not a healthcare professional, such as a patient, lawyer, friend of a patient, relative, parent, or child of a patient, within the framework of reporting suspected adverse reactions. Individual Case Safety Report, ICSR, is an adverse drug reaction report. This report covers one or several suspected adverse reactions to a medicinal product that occur in a single patient at a specific point of time. 4 minimum criteria: a suspected drug, a suspected adverse reaction, an identifiable patient, an identifiable reporter. Individual Case Safety Report, ICSR, Reports concerning cases when the 4 minimum criteria are not met and only information about 2 criteria, name of the drug and adverse reaction, is available must be submitted to the local qualified person for pharmacovigilance if available, or global qualified person for pharmacovigilance within a maximum of 24 hours. Special situations are situations that must be recorded regardless of whether they are serious or not and whether there is adverse reaction or not. Overdose, misuse, abuse, withdrawal syndrome, occupational exposure, medication errors, off-label use, suspected adverse reaction arising out of a quality defect or counterfeit medicinal product. Special situations are situations that must be recorded regardless of whether they are serious or not and whether there is adverse reaction or not. Use during pregnancy, either through maternal exposure or transmission of a medicinal product via semen following paternal exposure. Use during breastfeeding. Lack of therapeutic efficacy. Use in a pediatric population. Use in an elderly population. Drug-drug interaction, drug-food interaction, unexpected benefit. Any serious or non-serious adverse reaction reports must be submitted to your local, if available, qualified person for pharmacovigilance or global qualified person for pharmacovigilance within a maximum of 24 hours from their receipt. Information on an adverse reaction may be given to the qualified person for pharmacovigilance by phone, mail, or fax. Adverse reactions will be notified to the local authority regarding the timelines required in the territory. Although they offer significant benefits, medicinal products may also cause undesired side effects. For this reason, it is of great consequence to monitor any side effects caused by medicinal products. Responsible behavior to be exhibited by healthcare professionals and consumers about adverse reaction reports will ensure that associated risks are detected early and that the required measures are taken much more swiftly. In conclusion, the purpose is to ensure that the risk-benefit ratios of medicinal products in the post-marketing phase are optimized as much as possible in both the individual and societal levels. Thank you.